Okay, so now we are going to assess the eyes and the vision of our patient. So for the eyes is that we will gonna first inspect the eyeballs of our patient. So sir, okay, so look at the camera po sir. Alright, so we will gonna document that it is symmetrical and then it is okay. So next is the eyebrows. So as you can see, the eyebrows are symmetrical and then also have the same color that are equal. So we are going to document, and next is that we are going to assess the eyelids of the patient. So sir, look at the sa taas sir, sa taas. Okay, then go close. Okay, so the eyelashes are long. As you can see, it is long. And the next is that it has a space on it. And then when the eyelashes is closed, kumuklose siya, is that kanang magsugat ang nasa ubosan. And now we are going to assess the bulbar, conjunctivae, and sclerae of our patient. So, sir, kindly please look at here sa nang ubos na sa ubosan. Okay, and then sa taas pod, kita na ka ni sir. Okay, so it is clear, and then makita na to nga ang iya sclerae kay puti sir. Dol dire ang mata sir. Okay, tanaw sa ubos sir. Okay, sa taas pod. Okay, so moto siya. Then next is the palpebral conjunctivity. Kung unsay color siya doon sir. Tanaw sa taas. Okay, so makita na to pink ang iyang mata nga sa ubos. And then no swelling, free of swelling siya. Ano siya sir? Tanaw sa babaw. Ana. Okay, good. Next is the lacrimal apparatus. Kung ato ipalpit ang iyang mata. Okay. No lesions. Lesions. Next is the cornea and lens. So as we are going to look at the eyes, tanaw sa mga sir. Alright, so transparent siya, makita dyan nato, and then moist, and then lens are clear. Balik sir. See? Okay. And now we are proceed to the iris of the patient. So sir, tutok lang ta sa mata sir. Alright. Doon sir. So the iris of the patient, as you can see, round siya, and then also uniform color. Yes, the same sa right ug sa left eye. So now we are going to assess the pupillary of our patient. So first is we're gonna test the pupillary reaction to the light, or if it is direct or consistent. But first we are going to use the pen light. So, sir. Alright. So that's it. So we are going to document now. So now we are going to test the accommodation of the pupils of our patient. So we are going to use pen light na lang po. Okay, sir. Alright. Now we are going to document now. So as we document now the findings, the pupils, we have here some the equally round, about 3 millimeter in size, and then also the illuminated, and then the pupils constrict, and then the pupil opposite that one illuminated constricts simultaneously. So in towards account, the pupil is responses uniformly. So let's proceed to the other assessment by doing in the eyes and vision. Alright, next is the corneal light reflex. So we are now documenting, as you can see, just we're gonna put some light. Alright, so as you can see, the reflections of light noted at the same location of both eyes. So look. So now we are going to assess the cover test of our patient. So sir, kindly please tabon ang mga mata. Okay, so blur di mo pala sir?
No.
Sa pikas?
No.
Alright, so we can now document the findings. So for the uncovered eyes, it still remains fixed, and then covered eye does not move as covered is removed. Now we are going to proceed the cardinal gaze of our patient. So sir, you are going to follow this sir. Alright, this pen light. So let us proceed. Okay. Okay. Alright, so next is we are going to proceed the color vision of our patient. So we have here some Snellen chart sample, and then our patient will gonna determine of what color is this, right? Kung nasa malayo na ako ibutak. Alright, sir, let us now proceed, sir, if what is color. Sa kanang kaning nadiri
Green.
and then sa kanang ubos
Red.
red. Alright, kanang uban, sir, kanang dako.
Black.
Okay, black. So
Nyamatipan puti.
okay. So now we are going to document now the finding that as we assess the patient, and that the patient is the color vision is that it is able to identify the primary colors in a Snellen chart, and then also they identify the screening of correctly. So now we are going to assess the visual acuity of our patient. So sir, let's proceed in a distance. So you're going to assess this kanang imo lang tanan kung makaklaro ba ka ba sa salayo. Sige sir, kutob lang tanga race pila.
EFP, TOZ, LPED, PECFD, EDF, CZP, FLO, PZD, LEF, OD, FCT, TDF, LT, CEO, PEZOLOT, IFTD.
Okay. So, that's it po sir. So, mag-document na ta sa atong finding. So, as you can see, as we document the finding, maklaro man sa niya ang mga nasa Snellen chart. So, now we are going to proceed to the visual acuity, which is the near vision. So, we have here kanang pangtabo ni siyang mata, sir. And then, natay pocket size nga chart, nga iyang tanaw. So, sir, maklaro ba nimo kung nasa dool? Okay, I will gonna hold.
74, 2,843, 638, EWE, XOO.
Alright. So, that's it po, sir. So, as we document the finding, then, our patient reads print at 14 inches, and then, it is not difficulty. Alright, so we are going to proceed the visual acuity, which is the peripheral vision. So, for the peripheral vision, ang ato pasyente na siya pangkaan, which is the niya, sir. Okay, and then, ako sad kanya ako gamitan. And then, this is the time nga, ang atong pasyente, he will gonna locate the, kung asa dapit ako ang kamot. Alright, akong finger. Right, so sir, so good ta. So, sundangon sa'yo ako gikon sa finger. Alright, so, pick us a pod. Okay. Alright, so, that's it. So, as we document the finding, and then the peripheral vision, client sees the examiner's finger at the same time. So, the examiner sees it. So, it is visual field full by confrontation. So, that's it for the eyes and vision assessment. So, thank you and God bless.